The manuscript that I'll be discussing in this video is titled Resection of the Primary Tumor and Survival in Patients with Single-Site Synchronous Oligometastatic Non-Small Cell Lung Cancer, a propensity-matched analysis of the National Cancer Database. Historically, the presence of distant metastasis in non-small cell lung cancer patients was considered an exclusion criterion for surgical intervention. However, this paradigm is changing with the advent of newer and more effective systemic therapies, which may have improved synergism with local therapies, including surgery. The shift in perspective is particularly important for patients with limited oligometastatic disease. Prospective randomized trials have supported the use of local consolidated therapy for oligometastatic non-small cell lung cancer, and phase 2 and 3 trials are currently ongoing investigating this approach in conjunction with novel targeted therapies and immunotherapy. Despite this, surgery remains broadly underutilized for patients with metastatic non-small cell lung cancer. Our study specifically aimed to assess the impact of surgically removing the primary tumor on survival of patients with single-site synchronous oligometastatic non-small cell lung cancer. Using real-world data from a multicentric contemporary cohort, we identified several patient, institutional, and oncologic factors associated with the use of surgery. In a propensity score match analysis comparing overall survival in a balanced cohort of patients with similar characteristics, our study found that resection of the primary tumor was associated with a significant improvement in overall survival for patients who received a multimodality treatment approach. These findings align with the results of recent phase 2 trials, consistently highlighting the benefits of local therapy for patients with oligometastatic disease. While we await for further prospective evidence supporting this practice, our findings underscore the clinical applicability of primary tumor resection in the context of oligometastatic non-small cell lung cancer, reinforcing its potential to enhance overall survival in diverse patient populations. Importantly, our results advocate for the active involvement of surgeons in the multidisciplinary decision-making process for patients with stage 4 lung cancer. By ensuring their participation, we can better identify patients who are suitable candidates for surgical intervention and thereby optimize the treatment outcomes. Thank you so much.